Hi there, my name is Diana Karamakoska, and in this video we'll be looking at threats to communication. Communication in general is influenced by a number of things. This varies from others or the people surrounding us, our environment, our interactions, and technology. When we look at others or the people that we're surrounded by, they are essentially our opportunity for us to communicate with them. They will dictate how we communicate, what language we use, and whether we need to be informal or formal with them. Similarly, when we look at the environment or the social context in which we are living in, our communication will vary depending on what type of community we are in, what type of population we are dealing with, and also the cultural background of your client or patient. Interactions is also heavily tied in with the above. This is because we do change the way we interact according to who we are communicating with. In the workplace, you will notice that you adjust how you speak to your patients, as well as your superiors, team members, and health professionals outside of your organization. Think about the type of language that you use if you're speaking to a client in particularly, and then how you would reiterate that same conversation to, say, a fellow professional. We would have to consider how to approach our clients, as well as how to approach those in our organization and health professionals who might be working outside of our field. Now, technology has become a more common means of communicating, especially in the recent decade. We tend to base a lot of our communication through technological means such as emails, texting, instant messaging, and even through Skype calls. That's all well and good, but there are a lot of issues surrounding the use of technology, particularly when communicating certain messages. Technology can impede our communication skills, mainly because we're losing a lot of the interaction skills that we get from a face-to-face conversation. Current threats to communication are based around technology. When we look at this image, we are looking at the 10 levels of intimacy in today's communication. As you can see, talking is rated as the highest level of intimacy in today's communication. That's because we are getting that face-to-face interaction where we can immediately assess somebody's reactions, understanding, as well as addressing any concerns or issues or clarification that needs to be made between the sender and receiver of a message. The first 3 levels here are verbal means of communication. This tells us that our intimacy is largely based on being able to speak to each other, and humans are very social beings. The last 7, however, switch to written forms of communication. So at level 7, we have letters, and these are less commonly used today, especially when we have the technological means to transmit information. And as you will notice, the last 6 levels here all relate to an online form of communicating. The least amount of intimacy you will get is when you post something on either Facebook or Twitter. And that's because you're not really interacting with those individuals. You're just sharing your feelings or updating people about some news that's occurred. So why might these be considered a threat to our communication? There are several issues of late arising from the heavy reliance of technology, namely the inability to effectively communicate verbally or outside online contexts. And again, it's because of that lack of interaction from a face-to-face perspective. Technology is the most relied upon communication outlet, but it does present some serious risks and disadvantages when using it as a form of communication. It's a poor medium for communicating emotions. People rely on facial expressions and non-verbal cues to interpret the emotional meaning of their words. Online communication lacks this entirely. Even with the use of emojis, exclamation points, and capitalizations, we're still missing that core element to understanding that person's feelings or interpreting them correctly. Technology also reduces our politeness and respect when we are communicating through email, SMS, or through instant messaging. These messages can often appear less diplomatic and can be posted before emotions have actually subsided after an event. It also comes off as an impersonal approach to handling certain communications. So you must determine whether using a technological means of communicating with someone is relevant to your situation and appropriate. It's also a poor method for ambiguous, complex, and novel situations. These tend to require more information and proper guidance that could not be conveyed in an email, for example. In addition to this, you could contribute to information overload. This is where we are bombarded with constant inbox updates, new chat windows, or messages, and it's hard to juggle all of them at once, especially in group conversations where multiple people can be added so easily. A recent survey has indicated that people can spend up to 2 hours each day on average processing emails alone. And lastly, we look at security because it is the biggest risk factor of all. The internet is plagued with viruses, phishing scams, and spam emails. And this runs the risk of also having your emails hacked, so that whatever personal information is shared online is quite easily, and probably unnoticeably, accessed. Be mindful of what you do say online, especially when sharing some sensitive or confidential information. Technology does impact on communication for everyone that's involved. This will be you as a student and then as a practitioner. It will also affect your clients, your educators, and the interactions that you have with other people. We may have gotten used to using the shorthanded language that we do for SMS or instant messaging styles, but that type of language might not be appropriate when you are trying to converse with, say, your superior or another health professional in this field. If you're going to email them, be formal and ensure that you use the correct language and avoid using abbreviations. It's important to recognize who you are contacting, what the issue is about, and what means of communication is best required to approach them about this issue. As we've noted earlier, certain situations can't be effectively addressed through email and may require a face-to-face conversation.